It's 60% increase. Your deductibles are so high that nobody's ever going to use it unless you have a really low, slow, horrible death. Otherwise, you'll never be able to use it. The deductible is so high that you're not going to be able to use it. Your premiums have gone up 60%. It's a disaster. The same thing now is going to happen in the country.
And that was Donald Trump speaking about Obamacare at a rally in Dallas, Texas on Thursday night. Mr. Trump reminded rallygoers that just a few short weeks ago, Blue Cross Blue Shield, the largest private insurer in Texas, submitted a request to federal regulators seeking permission to raise those premiums, as you heard, as much as 60%. Meanwhile, the Associated Press reports a new study finds premiums for popular low-cost medical plans under Obamacare are expected to go up an average of 11% next year all across the country. And for more, we are pleased to be joined here on the anchor desk by Newsmax Health editor Tate. Nick is the author of the bestseller, DaVinci's Baby Boomer Survival Guide. And as always, thanks for joining us here on Newsmax Prime. Not exactly news that we want to hear, but you said there's actually some good news and bad news from this report?
Well, there's a sliver of good news. The bad news, obviously, is that these premiums are going up according to the Kaiser Family Foundation. This is an analysis by a nonpartisan group that finds that in 14 metropolitan areas, the average increase is going to be 11%, double digit. Yeah. And in many places like Washington and New York, it's going to be higher into the 20s, according to the request that insurers are making. Now, the good news is that sometimes it takes a crisis to motivate politicians and leaders to act.
Really? That's the sliver of good news,
That's the
Nick?
sliver I'm going to give you today, that the likelihood is that these skyrocketing health care prices, I think, are going to bring Obamacare back to the front and center in terms of the political debate. In recent months, the presidential candidates haven't been talking about it, members of Congress have not been talking about it, and I think that these numbers are going to drive that Obamacare debate back to the table, and we're going to have to hear more about it.
Yeah, speaking of this crisis, why are premiums rising?
It's two reasons, really. There are about 500 specific regulations in Obamacare. Many of them are very costly. Insurers have to hit new standards. There are new laws for doctors, hospitals, pretty much everybody in the insurance industry. And that's one reason. The cost for meeting those regulations is very high. But secondly, the federal regulators who drafted Obamacare needed to have a certain number of younger, healthy people sign up to offset the cost for providing health care for older, sicker folks. And what we found is that the vast majority of individuals, Americans who are signing up for Obamacare health plans, are in that older, sicker category. And as a result, to balance the books, the insurers are passing those increased costs for providing health care to those folks to everyone, which the law allows.
Now, the sign-up period is the week before the election, right?
Ironically enough, that's right.
So I'm sure we're going to have this topic come up for discussion in this debate. Now, Hillary's saying she wants to expand it.
That's right.
Donald Trump's been stumping around saying that he wants to repeal it. Has that changed at all?
No, we haven't heard many details about either one of those plans. The truth is that many years we hear for the candidates, there really isn't a choice. The Democrats and the Republicans are the same. The truth is that there couldn't be more different in terms of health care plans. Now, as you say, Hillary has suggested that she backs Obamacare. She wants to build on it and expand it. She's talked about holding costs down, but hasn't given us details. But one thing she has said she wants to do is expand coverage of Obamacare to the 12 million undocumented immigrants in this country, which some are concerned could be very costly. Trump, on the other hand, has said that he will repeal Obamacare, that there have been mixed signals about what he would replace it with. He's embraced the idea that he would use the federal government to drive down costs by negotiating with doctors and hospitals, which curiously is a hallmark of single-payer systems like Bernie Sanders' Medicare for All plan. So we haven't really seen the details.
It seems strange to have this be called the Affordable Care Act, but you're not really surprised, though, to see these rates go up.
I hate to say this, but the truth is that the concerns that were raised at the very beginning about Obamacare is that it would make health care neither affordable and it would nor would it increase the number of choices. And in fact, what we're seeing, this new plan from Kaiser Foundation shows that prices are not only going up, but the secondary thing that it found is that in most of the plans in the cities they looked, there are fewer options. Fewer insurers are offering plans. In fact, in 3 of them, you have a choice of between 2 insurance plans. That's it. That's it.
Wow.
So down from literally dozens of options you may have had in the years before Obamacare, we're now down to 1 or 2. So it's really incumbent on consumers to be careful about their choices. I would argue in terms of not only picking health care, but in picking a presidential candidate as well.
Well, Marilyn Tavenner, the former executive who oversaw the rollout of healthcare.gov, recently spoke at a healthcare conference in Las Vegas, and she says the focus shouldn't be just on volume. Take a listen.
If we are to be successful in managing cost, we can't just have a single actor out there standing against the tide. We are going to need to change the direction of the tide. We need to get everyone working toward a common goal of achieving value rather than working to maximize volume.
Do you think her message will be heard?
You know, this is a person who really was in charge of the healthcare.gov rollout under Obamacare. Now she represents the insurance companies, and she is singing a different tune. I do think that she has a point in that she's saying that insurance companies are merely responding to the demands that the federal government is making and requiring them to cover everybody, and the costs that are being passed on to consumers are just the cost of doing that business as the rules have been changed by Obamacare. The question that I have is how receptive would the insurance companies be to negotiated plans that are likely to come forward that could end up costing them money? One, for instance, that we expect to be a part of the Republican plan is to expand the ability to buy insurance across state lines. Insurance plans are very different by state. They're hundreds of dollars more in certain states than others, in certain metro areas than others, and it remains to be seen how the insurance companies will respond if in fact consumers can make those choices, which is one of those pillars that's likely to be part of the Republican plan.
How high do you expect premiums to go?
Well, what we're hearing from Marilyn Tavenner is that they're likely to be in the 12 to 15% range, at least for the next year. This is 2 to 3 times what was projected just a year ago by the Congressional Budget Office. So the bad news is consumers are going to have to certainly dig deeper. Just how much deeper, we don't yet know. We will know by the end of the summer for sure.
2 to 3 times higher. So, of course, I'm sure all of you that are watching at home are going, okay, great, what do I do?
Well, there are some things you can do, and in fact, the time has come that you don't have a choice. You have to be a savvy consumer. You really do have to compare and contrast plans. You can't simply go with the plan you have today. You have to do your homework and make sure that your plans the prices are more affordable. There are options out there, but you need to look at more than just the premiums. You need to look at deductibles, you need to look at drug costs, and you need to make sure that your doctors and your hospital networks are on the plans that you get. You should also work with your doctors. There's a range of things that they can do to help you with drug costs. There are drug assistance programs. Some will even help direct you to independent clinics that will do things like CAT scans and x-rays that are literally hundreds of dollars cheaper than if you did them in a hospital network. So just as you are savvy with the choices you make at the supermarket and at the store and, you know, for buying a car or a house, you really have to be this way with your healthcare planning as well.
Yet I'm hearing you just mentioned earlier, you may only have 2 options. So you probably need to get involved in this political process right here, right?
Well, as I would say, since picking a health plan will begin the week before the election, as you're picking your health plan, maybe that will put you in mind of what kind of candidate you want to pick to be running the country come January 1st.
All right, Nick Tate, always a pleasure to have you, even if it's not always to hear good news, but we do appreciate you keeping us informed. We'll be right back with more.